Hi students, today I am going to talk about the cardiac cycle in very short, and what are the from where the question mainly asked in the cardiac cycle that I am going to discuss. First of all, what happened? All the four chambers of heart are in relaxed state, that is called as joint diastole. Okay, so at the time of joint diastole, this tricuspid and this bicuspid, both valves are open, and this pulmonary semilunar valve and here aortic semilunar valve, both are what? Closed, and this tricuspid and bicuspid valves are what? Open. So if in the NEET exam they will ask you the question in joint diastole, which valves are closed, which valves are open, so you have to write at the time of joint diastole, when all the four chambers of heart are in relaxed state, at that time both bicuspid and tricuspid valves are open, and pulmonary semilunar valve and aortic semilunar valve are closed. And one more thing, at the time of joint diastole, the impure blood from the upper part of the body like head, face, neck, chest, upper arm, that all is coming into the right auricle with the help of superior vena cava, also called as the precaval, and the deoxygenated blood from the lower part of the body, that is coming into the right auricle by inferior vena cava, also called as the postcaval. And in the heart muscles also the deoxygenated blood is synthesized, and because heart muscles also need blood, and the artery which supply oxygenated blood to the heart muscle is called as the coronary artery, and the vein which is taking back the deoxygenated blood from the heart muscles, that is called as the coronary vein. So coronary vein all joins to form what? Coronary sinus. Okay, so by this the blood, deoxygenated blood from the wall of heart is coming into the right auricle. From the right auricle, the deoxygenated blood is flowing into the right ventricle. How much percent? 70%. Now, from this pulmonary vein, okay, actually here I should write, this is by this four pulmonary vein, oxygenated blood is coming into the left auricle, and that is going into what? Left ventricle. How much percent? 70%. So this is the case of what? Joint diastole. Soon after that, what happened? The sinoatrial node, which is a electricity producing tissue inside the human heart. That's why the human heart is what? Myogenic. Myo word is related to what? Muscle. Genic means what? Generation of nerve impulse. So this sinoatrial node generates the impulse or electric current. Why it is generating? Because of opening of calcium ion channels. Calcium ion channels get open, that's why it is producing the electricity. Okay, and one more thing I want to discuss in very short about the nodal pathway. So this is the patch of muscular tissue which is generating the electricity, and here in the lower right upper corner, sinoatrial node, so it is generating the 75 beats per minute, 70 to 75 heartbeats per minute. That's why it is called as the pacemaker of heart. Whereas at the lower left corner of the right atrium, we are having atrioventricular node, AV node. It is generating 45 beats per minute. That's why it is called as the pace setter of heart. And sinoatrial node and atrioventricular node are connected to each other with the help of internodal pathway. These are the bundles of fibers which is connecting the SA node and AV node. That is called as the internodal pathway. Now, from the atrioventricular node, a bundle of muscle fiber come out. That is called as the AV bundle, atrioventricular bundle. AV bundle is divided into the two bundles. This is the right bundle, this is the left bundle. And from the both bundles, number of muscle fiber cells are coming out. Okay, so that is called as Purkinje's fiber. So Purkinje's fiber along with the right and left bundles are called as the bundle of His. Now what happened? As this sinoatrial node generates the electricity, both of these atria undergo systole. That means what? Contraction. So because of contraction, the flow of blood from right auricle to right ventricle and from left auricle to left ventricle increases by 30%. Okay, as a result, both of these chamber, right and left ventricle, are totally filled with what? Blood. And just after that, both auricles are started going into diastole, means relaxed state. At that time, both ventricles are started contracting and going into what? Systole stage. Okay, so joint diastole is possible, but joint systole is not possible. Okay, we can't hear that all the four chambers at the same time are getting systole, means contracted. It's not happen. So this both auricles start undergoing relaxation and both ventricles start undergoing contraction. That means ventricular systole. Okay, because of that what happened, already these two chambers are totally filled with blood. This is right ventricle and left ventricle, and this is contracting also, systole. So because of that, because of high blood pressure, the blood want to go back into right auricle from right ventricle, left auricle from left ventricle, but blood can't able to go back. Why? Because this wall, tricuspid and bicuspid walls are what? Closed. Because of that. So as a result, now where will the blood will go? Okay. So because of that, this both semilunar wall get what? Open, and blood start flowing from right ventricle into the pulmonary artery and from the left ventricle into the systemic aorta. So blood will go from pulmonary artery to the lungs for the oxygenation. As you know, this part, right part of the heart is called as the pulmonary heart, and left part of the heart, LA and LV, that is called as what? Systemic heart. So from here that deoxygenated blood goes to the lungs, and in the lungs oxygenation process takes place. After that, after oxygenation, the blood is coming back into the left auricle, and that is going to left ventricle. From left ventricle it is going to systemic aorta, and the oxygenated blood is divided to the different body tissues. You know that this systemic aorta is divided into, aorta will divide into arteries, arteries will divide into arteriole, arteriole will divide into what? Capillaries. Clear? So when this both undergo contraction, they are undergoing relaxation because of this both wall open. Now here if the question of the NEET will come, when the bicuspid and tricuspid walls are closed, you have to tick on what? At the time of ventricular systole. If the question will be asked when both semilunar walls are open, then you have to tick on what? Same, when both ventricles undergo systole, at that time this both pulmonary semilunar wall and aortic semilunar walls are open. Clear up to here? So, and hold this cycle. Okay, so this after some time again this both ventricle come into what? Relaxed state, and again all the four chambers come into joint diastole. Clear? So for this one cardiac cycle, the time required is 0.8 second. That is the duration of one cardiac cycle. In one cardiac cycle, both the ventricles, right ventricle, left ventricle, pump 70 ml of the blood into the pulmonary artery and systemic aorta. That is called as the stroke volume. So what is the stroke volume? Volume of blood pumped by the each ventricle of heart during one cardiac cycle. That is called as the okay. So and in 1 minute, how much volume of the blood is pumped by the each ventricle of the heart? That is called as the cardiac output, whose value is 5000 ml or 5 liters. So this was some basic point. And one more thing I want to discuss here is what? See, the time required for the systole, for the contraction of both atria, is 0.1 second, and time required for the diastole of both atria is 0.7 second, and the time required for the right ventricle and left ventricle to undergo systole, that is 0.3 second, and time for going back into the relaxed state of both ventricle is 0.5 second. So if you want to take out what is the time duration of joint diastole, so joint diastole equal to total duration of cardiac cycle minus total systole. So total duration of cardiac cycle is 0.8 second, and total systole, so systole of atria 0.1 second, systole of ventricle 0.4 second. So 0.1, okay, this is 0.1 and this is what? 0.3. So 0.3 plus 0.1, how much? 0.4. So 0.8 minus 0.4 equal to 0.4. That is the duration of 0.4 second is the duration of what? Joint diastole. I hope you all understood. Thank you very much.